So now I'm going to talk about the surgical options for treating gynecomastia or male breast hypertrophy. Typically, the goal is to get that volume of breast tissue down. But on occasion, sometimes patients have excess skin, and sometimes we need to consider how to get the skin to become less as well. So looking at this picture, which is the diagram of a male chest, we have the nipple and areola, which is typically centered on the lower part of the male chest. Typically, we like to have some musculature, which is the pectoralis muscle that helps accentuate that upper male chest. The things that take away from the cosmetic appearance of the breast is either excess skin, which can either displace the nipple or the lateral parts of the breast, or both of them, or the excess volume. Sometimes it's both of those together. And so, in order to make things look as nice as possible, we need to decrease the volume and try to get that skin to be the right contour to the chest. Sometimes this involves just removal of the breast tissue, sometimes it means removal of the fat, sometimes it means removal of skin. Typically the approach that I take will be a combined approach, which involves liposuction to remove some of the fat, and then a small incision below the lower portion of the areola to remove the remaining breast glandular tissue. Afterwards, we would put in a drain that would come out the side to collect the fluid that may build up in this area, and then we use compression therapy to help get that space to obliterate. On occasion, sometimes we actually have to reposition where the nipple is or remove some of the excess skin, and that may involve incision around the areola, sometimes a vertical one underneath, sometimes a vertical one with an inverted T shape. So in the post-operative course, after having gynecomastia surgery, in the technique that we talked about where there's an incision below the lower portion of the areola, typically the scar is right here. Now one of the benefits of this surgery is because everything is contracting, everything is getting smaller, that scar tends to be well concealed, and most patients don't complain about that scar. So after the surgery, there would be a drain that comes out right here, typically in place for a week. You just have to empty and record the output a few times a day at first, and then usually just once a day, and then in the office we just remove it. You would also wear a compression therapy that I'd like you to wear pretty much all the time for the first 1 to 2 weeks, and then when you're up and about for the next month. At about 6 weeks after surgery is when you get to full activity, meaning no restrictions. But usually you can start exercising with cardiac activity and beginning scar massage about 2 weeks after surgery. At 6 weeks after surgery, I recommend a regimen to try and build up the upper chest muscle to fill out some of that space where the breast tissue has been removed. Typically, I recommend patients do about 100 push-ups a day, but sometimes you may come up with some other regimens to help accentuate your pectoralis volume.